super excited to have Matt Varghese with us from Agilon Health. Matt has been a career HR professional for over 2 decades. Matt, I've been going through your profile and it's super, super interesting. So I'm going to jump right into it because what you have basically done is you have spanned your career across multiple industries, right? And they are fairly diverse, right? I mean, you've done financial services, you've done consumer goods in the food space, and you're in the healthcare space. And I think maybe you're a bit of healthcare with tech. So it's like a health tech kind of space, right? So my first question is, if you look at talent in all these various industries, which one would you think, and I'm going to put you in a bit of a spot to start with, which one do you think would be the most difficult to manage, right? Like managing talent, which will include attraction as well as retention, right? Among all the industries that you have worked in.
Yeah, and it's a great question. I would say, the space that we're in today, specifically in healthcare, post 2020 is what I'll say. When you think about the post-COVID era, and sort of what that did to healthcare professionals in this space, that we're in this interesting time where there's a lot of things that are essentially merging together in this confluence of people wanting to work from home, people who want more flexibility in what they do, talent that has really got the ability to do a lot of things, not only remotely, but the need to come into work and to really form community. So in healthcare, that has to be done in person, right? Healthcare has to be delivered in person. But a lot of the infrastructure that goes around it can be done almost anywhere. So I would say this is one of the most interesting places from a talent perspective, because we are really living in this hybrid world and space where all services need to be delivered, obviously, in person, to make sure that our partners and ultimately their patients are getting the best care possible. But everything around that, supporting that, can be done almost anywhere in the world, right? And so I would say this current place in the healthcare technology place is probably where I'm finding, not, I wouldn't say the most challenging, but probably a lot of the most interesting and fun challenges to sort of attack and address in trying to help grow a company like we're doing here at Agilon.
Great. That's very interesting. Let me ask two questions leading from what you were saying. One is, if you look at healthcare and health tech, right? One obviously is the attraction problem, right? Like getting talent itself in an industry which is hyper competitive and growing, as you rightly said, at a hyper speed, right? For lack of a better word, right? Getting talent is obviously very, very difficult because there's a lot of competition, right? So probably, if you can spend a couple of minutes just describing that challenge, right? And how does that compare vis-a-vis maybe with some of the other industries that we have worked in the past? That would give our listeners, a bit of idea of, how it is on the ground.
Yeah, it's interesting. I sort of, the reason I mentioned what I did earlier around the challenges and how do you address those things in the marketplace where we're at as a company versus, let's say, a very large company and that's in the technology space is, when you're smaller relative to some of the technology giants, you're not going to have the name recognition, right? And so you have to almost, ensure that you're getting people to buy into what the vision and the mission of the company is versus just the name on the company, and ultimately somebody will put that on then for their next opportunity to move on. But at our company, it's really not hiring for somebody who's got great talent, but the talent plus the culture fit, which is what a lot of people end up saying. But you really have to live that these days, because if you're not going to get the talent that ultimately wants to stay in the organization, you're going to have a turnover problem, right? So what I try to look at is, it's actually 3 steps of the same process. It's the talent acquisition. Once you get them in, you got to be able to develop them. And once you develop them, you got to be able to keep them and retain them. getting them in, in our case, for example, you want to make sure you're getting the right people in, not just the super bright people, but the people who fit your culture. And for us, that means they have to be willing to fit in with our vision and our mission. And what we find when we do post-onboarding surveys is that one of the major reasons people want to work in our organization versus, let's say, just a technology company is that they are attracted to the vision and the mission of wanting to help improve the lives of other individuals. So, in fact, it's far outweighs any other reason why anyone would join our organization.
That's very interesting. So would it be fair to say that most of what you're competing with for talent would be with other tech companies, not really with healthcare companies? Because most of your hiring would be health tech, not pure healthcare. Would that be a fair statement?
Yeah, I think that's fair to say. We our technology organization, we just to put it in perspective, we were talking a little bit in numbers here. Our company in 2021 was just about north of 550 people. Today, we're just north of 1,000 total employees. When I look at the growth of the technology, headcount within the organization, it's by far the number one or the fastest growing function within the company. And when you look at the last 2 years, so we really built it from the ground up. And we're continuing we just made an acquisition of a company, which brought another 150 employees or so into the organization earlier this year. So we understand that what and how we're going to differentiate ourselves in this current market space of helping our partners to be successful is through our technology. And that space, to your point earlier, is not only is it competitive, but you have to get the people who want to be within your organization for a higher purpose if you want them to stay beyond a year or two and then move to the next company. Now, I will say this, generally speaking, in the technology space, as I think is it's no secret to anybody, it didn't hurt that earlier this year there were some large layoffs at other large technology companies. So when you juxtapose that to hyper growth companies like ours, where you have both, this intrinsic reason why people want to join, but at the same time the hyper growth to go with it, it's sort of the best of all worlds.
Would it also be fair to say, Matt, that health tech is relatively unaffected by a bit of a slowdown that we have seen in some of the other sectors in tech? Would that be a fair statement?
I think specifically, and I'll mention this relative to our company, and as Jess and I were speaking earlier, we're growing at a 50% clip year over year for the last several years, and we're going to continue to grow at that clip moving forward based on everything we've shared with the marketplace. So when you consider our total addressable market, we've only really just begun to tap into all of that. There is a huge amount of need, especially when you're talking about value-based care, right? And the fact that there is a need to shift from where we are as a country away from fee for service services into a value-based care arrangement. When you think about the macroeconomics associated with that and what our company does to help facilitate that and helping our partners, physician partners, to be successful in making that transition, there's a tremendous amount of work still left to do, which is why I think, to answer your question very directly, the healthcare tech space in relative to something that we're doing, we're not going to be slowing down anytime soon.
I think that'll be a music to a lot of our listeners who are, slightly scared about, the slowdown in tech. Over to you, Jess, for the next part.
Yeah, Matt, I think the last numbers I saw, you guys had maybe a valuation of like $7 billion. Is that right?
Yeah, I would say a little bit north of that, depending on the fluctuation in the stock price. That's about right. About 8. Yeah.
Okay. Yeah, don't short me that last billion. Right? So, so many of the people listening on my side of things are startup founders, investment managers, or CEOs, or people who want to be them. And, 50% growth, getting to the $8 billion mark. Like, this is something so many folks would like to do. I've kind of a two-part question, so I'll start with just one of them. But when you observe what you guys are doing different at Agilon, that others aren't doing, that are producing this type of, magnetic attraction of customers, what's something that you think is going on over there?
Yeah, it's what I would say is it's really a confluence again of, the company itself started several years ago, 6 to 7 years ago, and you have to start with sort of the founders of the company, Ravi Sachdev, really having the foresight and the vision to say, okay, we believe that this is where, once again, on a macroeconomic basis, where fee for service and value base and risk taking is going to move within this country, right? So that you've got very large macroeconomic, shifts going on. On top of that, you have to be able to produce and or perform to show that this is early on, this is going to work, right? That this shift to value and into risk is something that is going to be fruitful for both physicians as well as for our organization to make sure that we can start up a company and run it successfully and scale it successfully. So I think the key there is that shift. It has to be for physicians and our physician partners, helping them to get out of the rat race of, what I call the rat race of the fee-for-service world and into the value-based world. And that's where we can bring, capital, where we can bring technology, where we can bring expertise. And it goes back to one of my earlier comments that I made around, sort of vision and mission and people joining an organization who are like-minded in that vision and mission. So it doesn't stop. And one of our values as a company is around having a one-team mindset. That is not just relative to our 1,000 employees that work at Agilon, but it extends to our physician partners, of which we have 32 partners that we will be doing business with, by the end of this year, going into next year. And so we have to be all on one team. We have to be like-minded. And so to answer your question very directly, Jess, how does one get there, right? How do you get to this valuation? How do you grow at the scale that you're growing? I think number one, the macroeconomic factors have to be there when you're talking about the growth. But number two, in order to be successful in any venture, but one where the macroeconomic situation is changing, you have to be able to show that you're going to be providing that service, and that's going to be beneficial for your partners as well as the rest of the organization. And that sort of then leads to other physician partner groups saying, help me get out of the rat race, help me make the transition. And so, all these things tie very nicely and neatly together, because our vision, just like any company has a vision and a mission. I referenced that, by the end of this year, going into next year, 32 partners that in 14 geographies that we're going to be doing business. Our goal is, in our vision, to be in 100 plus communities, transforming healthcare across the entire country, right? And so it's not hard if you're helping others to be successful, and you can sort of prove that out, because others will then organically want to be a part of that.
I got to go to Nigeria with the U.S. Special Operations Command and teach a class. They were starting the Nigerian Special Operations, so it's special forces guy, Force Recon Marine, and then I brought a 25-year Navy SEAL client of mine. We team taught this class, and we were meeting with these generals and all sorts of, the high ups. And every time the SEAL buddy who was with me, he'd take me aside and he's like, "What's in it for them? Think about what he said. Think about what we said. Why did he say what he said? Why did we say what we said?" And it was just like, it was like opened my mind. Like, so many people say that, but like he lived that.
Yeah.
And it's like, it had such an impression on me all these years later. I never think about the way that he had internalized it. And so it sounds so simple, but like, what's in it for them? What's in it for the partners? What's in it for the customers? Like, if you have a bigger lever, if you have more leverage on your what's in it for them is bigger than somebody else's what's in it for them, right?
That's right. That's right.
And I feel like maybe we should have started the episode this way, but for people who don't understand the unique offering from the company, can you explain that?
Yeah. So in a nutshell, I let me start very high level, and then I'll get into some more of the weeds. But at our core, what Agilon does is we bring the joy of being able to practice medicine for our physicians and physician partners, so that they can help their senior patients improve health outcomes, right? And that's what we're there to really help those physician partners be able to do what they do, right? And how do we do that? This goes back to the talent discussion that we just engaged in. We hire people who live our values and want to be part of our mission and our vision. At the end of the day, what we do is we want to make sure that these partnerships are successful, and we do that by helping them make the transition, like I said, from a fee-for-service world into risk. And what that means is we as a company will begin to essentially take on the risk for them, right? So when they have patients who are coming in and they don't have enough time to see those patients because they're trying to run from patient to patient in a fee-for-service world, the entire value-based approach is not about the quantity of patients, but the quality of care that you're providing for them. So what we as a company tend to do is say, okay, rather than going from patient to patient to patient, let's focus on this senior population and make sure that they're coming in, for an annual wellness visit. So you can identify what chronic conditions that they may have. But if they, let's say, don't do that for a couple years, they're just getting sicker and sicker. And what that happens is, you get more sick, you go to the doctor more, they don't have time because they have to see a bunch of other sick people. And it sort of begets itself, right? So what you have to do is, and this is where we also offer, and we as a company, we go into business with our partners and we say, we're going to put up capital, we're going to invest in technology, we're going to invest in human capital to help support, how do we identify those that are the sickest and making sure that they are coming in on the appropriate number of visits? How do we make sure we capture the illnesses that they do have? If they are not ill, how do we make sure that we are staying ahead of that curve and that they have annual wellness visits scheduled? And we want to make sure that this, apparatus is once again supporting the physician partners to do all those things effectively, because that's what we want them to do, is focus on the patient and physician relationship and make sure that they're getting the quality care that they need to get, versus every 15 minutes having to see somebody, because in a fee-for-service world you do that. And then we take a lot of the risk associated with the downside, or the risk associated with sicker patients or patients who may not have identified an illness and then end up getting it sick and having to be readmitted into the hospital system or for any kind of care. So we do that through different focus areas that we've got. But in a nutshell, it's making sure that we're getting people in on their annual wellness visits, that we're identifying chronic conditions, that there may be suspect conditions that haven't been identified, but we're also looking at that and saying, hey, we noticed that these things popped up from your last visit. is there a possibility that the physician should look into this and seeing if this is something that an illness that someone may have?
And so just to understand that, essentially you guys are adding more personnel and more tech so that the doctor isn't as rushed, because a bunch of those other things are getting handled through technology identification, through other personnel, so that when the doctor is with them, they can be super present. They're not just getting on to the next 15-minute appointment. Is that?
You got it. So I'll take coding as an example. Typically after a patient goes in to see a physician, there's certain codes that are applied to when that visit occurs. And prior to the visit, the same thing happens. It's okay, here's the chart, but do you have time to look at the entire chart prior to an individual's visit? And after the visit, was everything coded correctly? Prior to the visit, once again, our team will be looking at things to say, hey, we noticed A, B, C, and D. Hey, doctor, you should look at, does this person have perhaps susceptibility to this chronic condition? Do they have it? Do they not? Please look for that in your visit. Because we have an entire team helping the partners and the physician partners team engage in this process. Secondarily, after the visit, we also have people making sure that concurrent coding is happening, so it can be as close as possible to same day within 48 to 72 hours, as opposed to, hey, I forgot what happened there a week ago. I think I coded this. Let's send this along the way and get this person checked out, because you tend to lose information over time as well. So, and then from a technology standpoint, what I would say is, especially in the value-based care space and world, very few, if any, organizations are able to not only have what I would call health plan data, but clinical data all together in one place for partners and for us as an organization to look at trends, to look at what's going on, whether it be in a region or a state or a city or a particular partnership, right? And so this is where the power of the network actually comes into play, saying, hey, these partners are really good at identifying these conditions or helping to be successful in the risk adjustment area or in the coding area. How do we use that power of the network for these other partnerships that we have in another part of the country to help be as successful, right? And so what you end up seeing is the technology and the network together are a powerful tool which make up our total care model, which, we don't own our physician practices. We partner with our physician partners, right? And there's a huge difference in that, because once again, it goes back to this idea of our vision and our mission is to help our partners transform healthcare. It's not us. It is us helping them in their local communities to transform that healthcare, because they have those relationships with the patients.
No, that's exciting. Like, I was just thinking about these regional trends, and I'm going back to our pre-interview debate between Chicago pizza, New York pizza, and
right.
Detroit deep dish. And like, I'm seeing Detroit deep dish making real inroads out here in Salt Lake City, Utah. So I'm guessing we're gonna have more diabetes and more heart disease, because that's so
right.
good, it's addictive. So the doctors can know to ask, have you been eating your Detroit deep dish?
That's right. That's right. That's right.
Okay. So I'm gonna ask one more, and then hand it back to Gautam. When you think about recruiting for an organization like this, I get to interview a lot of great health tech and med tech entrepreneurs, and a lot of them are growing incredibly fast. And so my question is, this idea of making people's lives better and these kind of sayings, there's a number of med tech organizations that would claim that same thing. So when you're trying to attract top talent to you guys versus the other fast-growing med tech opportunities out there, health tech opportunities, what's something that you feel like your years of talent acquisition have helped you to do to win those, high priority candidates?
There's several areas that I could go into here, but it goes back to once again, I'll go back to something I stated in terms of when you attract talent, you've got to be able to develop that talent, and then you've got to be able to retain the talent, right? And, depending on where one is at their particular stage in their career, one thing may be more important than another, right? And so, I think that is a personalized, obviously, on an individual by individual, case by case basis, what's most important. But what I can say is, I believe at our company, at Agilon Health, we try to look at every stage of this and have something for attracting talent, developing them, and retaining them. And what I mean by that is this. When an individual joins our organization, by and large, I already mentioned one of the main reasons is because of what we do and sort of the intrinsic value that's associated with helping others and helping transform the healthcare landscape. When you join the organization, there are three sort of what I would call platform-wide or enterprise-wide development tools that we have. One is an individual development plan, because we know anybody can go just about anywhere in healthcare tech these days and work for a number or a plethora of different companies. But the bigger question is, what do you want to do with your career? And how can we help you to be successful, right? The second is we obviously invest in our people from a broad-based development perspective. So we just invested in Workday Learning. We contracted with LinkedIn Learning to be the content provider. Over 10,000 courses. It could be in the technology space. A lot of our technology team uses that for specific tech-enabled, but also soft skill related training as well. And then licenses and certifications. We help our team to get those things. That's just at the entry level. Then we have something known as Empower, which is it's a training course for underrepresented talent, historically underrepresented talent in the organization. And I've already mentioned that we just went over 1,000 employees. We're about to start our 6th cohort of this particular group of development and training. And it's for, like I said, individuals trying to find their voice, presence, learning how to be a leader. We've had 109 employees go through that training already. Then you have a manager essentials course, first-time managers, learning how to get things done through others. We've just kicked that off at our first graduation in February of this year, 27 participants. And even at the most senior level, we've just completed a course called Leading with Impact that we contracted with Northwestern University in Evanston, Illinois, a full week for approximately 25 of our top leaders across the company. So if it's learning and development, we want to make sure we're investing at every level. We also want to make sure that this is a learning and development culture, and that's an expectation. We want to create better life experiences. So we know how important it is to not only have work-life balance, but to be involved in the communities that we're working in. And so we're involved in things like the Alzheimer's walk and on a national basis, and we give money for that particular event. And so we're trying to make sure we have 5 key tenets that we try to meet people where they're at. It's around accelerating talent development, creating incredible career experiences, making sure the company has efficient organizational structures and processes, that we are a learning and development culture, and that we're creating better life experiences for people, not just work experiences. So whether it's L&D and development, whether it's, hey, I want to get involved in my community, hey, I'm really focused on my career, and I want to be able to accelerate that, we have something for just about anybody from an attraction standpoint, but more importantly, when we get them in, because they have to fit within our culture, because there's a lot of great talent out there, but what do they say about culture? Culture eats strategy for breakfast, right? Got to be the right fit for our culture. And then we have all these tools and processes for development. And then we're hoping that we can retain that talent which we're seeing that we're able to, our retention rates and have gone way up. Our voluntary attrition rates have substantially fallen. It's actually close to 13% on a voluntary basis here to date. And trending to 13% for a full year basis, which is significantly below the national averages and even within tech. So I think it really depends where you're at when you're trying to attract the talent, for what reason. But I feel like at our organization, we have something for just about every level that you want to engage in. It just depends what is it that you're looking for.
Yeah. No, that's such a great answer. Gautam, I know this has got to be bringing up a bunch of questions for you. I'm going to hand it off.
Thanks, Jess. One thing which caught my ear was the role of data analytics.
Yeah.
Right, in what you're doing, and I was hearing very intently because at Cbrex, we have built a marketplace, and you know how important data analytics is.
Yeah.
Right? If you want to offer that, a cutting edge advantage, in your case to physicians.
That's right.
Right. So just wanted to spend a couple of minutes on that because that's a skill which is in heavy demand.
Yeah.
Right. And will always remain in heavy demand. Right. Because at the end of the day, you need people who can make sense of data. How do you get data to talk to you, if I can use that phrase?
Yeah.
By itself, there's no use.
That's right.
Unless it can talk to you. Right. So
That's right.
What have been some of your experiences in Agilon on that space? Like, do you think that's one thing where you are getting talent in, or is that something which is tough to hire? What's been some of your experiences around data analytics?
Yeah, we are for sure getting talent in the data analytics space. It's a very hot marketplace, as you already mentioned, Gautam, and it's not only is it a hot space, but when I just talked about our learning and development at the most senior levels, we just went through a full week course at Northwestern. The number one area that our executives told us that they both appreciated as well as think that it's the biggest need, not only within our organization, but in most companies, is how do you tell stories with the data? It has to be able to tell you something, right? Because what you have is, interestingly, like just data for the sake of data you can make data say a lot of things depending on how you manipulate that data. But it's bigger. The bigger question is, what is the story behind the data, overarching, or I call it longitudinally, to show people context, right? Like, what is it and how is it that we should take the information and apply it to a current situation? And so, to answer your question very directly, it is a hot space. It is definitively a hot space. I had even mentioned earlier this year, we acquired a company. The name of that company is MPHRX, My Personal Health Records. And, that's part of why our story is, we want to be able to tell the story not only with what health plan data is saying to our partners, but what is the clinical data accompanying that health plan data, telling not only our partners, but us as a company, and how should we help our partners to be successful based on all of that. So I would tell you that this is going to be one of the most data-rich companies in the world in the future. It's just tons of information going back and forth, but the real value in that is not just the information. It's what story are you telling with that data? Because you're getting all this information from the health plans, but also getting all this clinical information. When you can merge all of that together and then give a full picture and story, it's a far different picture that you can paint, as opposed to just having one set of data versus the other. Does that make sense?
Yeah, that makes sense. So I want to switch track a bit, Matt. You're Chief People Officer of Agilon, and as I said earlier, you had a very, very diverse career spanning many industries. So now I'm going to ask you about yourself. So what has been the most exciting part of being in HR. And when I'm saying HR, it will also include TA because TA is a subset. So what do you think, if you look back at the last, say, 2 decades now, so what do you think was the most exciting part, or what do you think is the one which you really remember? It could be an incident or or just a part of a journey, but what is it that would be the most exciting part of your journey so far?
It's a great question. I always tell people my personal story on how I even got into HR. So I have a very interesting background because I went to school to be an engineer, and after 4 years of going to school, I figured out, I'm probably not going to do this. Not sure if I'm not good at it, but it did provide me a lot of process orientation, right? And so very methodical in your approach. What I wanted to do, and what I ended up getting my master's degree in, is social. I wanted to help people. Once again, you go back to fit, culture, intrinsic reasons as to why you want to do things, right? And who's going to be successful in an organization like ours. So that's what I ended up getting a master's degree in, is a master's in social work. And then life happens to you, and my father passed away, and so I stayed close to home. And I actually utilized my engineering background, and I became a technical recruiter. And that's how I got into HR, and probably, one of the most impactful decisions of my career, that not only to take that particular job, but, one day, someone told me, hey, you're good at, the business side of things, and you like to help people. Would you ever consider going into HR? And I said, well, I really hadn't thought about it, but I ended up going to graduate school again and got another degree, and, loved my time there, loved everything and my experiences. And, I would say those two things, the way that life happens sometimes and your openness to it. But for me, the whole reason I got into HR is still the reason I'm in it today. It's you ultimately want to help people, but at the end of the day, I'm using really my process orientation that I learned through engineering as well, and putting the two together to help drive business outcomes and helping people along the way, if that makes sense.
That makes a lot of sense. And that pretty much leads me to my next question, right? So if you look at tech in HR, or tech in recruitment or recruiting, right? Like Agilon is in the cusp of healthcare and tech.
That's right.
At CBREX, we are at the cusp of recruiting and tech, or recruit tech as it's popularly called. Now, you're from an engineering background, right? And you obviously seen tech evolve in HR or in recruiting. Right, especially in the last 10 years. I think the last 10 years have been, fairly revolutionary, if I can use that.
That's right.
What are some of your views on tech in either HR or in recruitment? How are you seeing that move, or how have you seen that move in the last decade or so?
Yeah. So the short answer is dramatically. It's shifted dramatically, over the course of the last 2 decades, but more specifically the last 5 to 10. There's so much specialization now, right? So you could be a tech entrepreneur in TA, but within TA, you can subspecialize and have a tool or a niche, for assessments, for predictability, right? There's so many different things in each area, and the specialization has become so incredibly sophisticated that sometimes it can be overwhelming to try and figure out which tool is the best, or can I find a tool that addresses multiple components versus just a specialization, right? And that's part of the challenge, I think, with technology in general. That's why I think, when you think about some of these very large companies that are out there, same thing as what we are doing is you're filling a need that's happening on a macro level basis. And because so many people have that need, and so many people have realized the benefits of these needs, and by using this technology, whether it be Apple or Microsoft or anything else, right? In our space, it's the same thing. Agilon is filling a need in the marketplace that there's a huge need. But in health, in HR specifically, there's so much specialization that engagement survey, I'll take that as an example. So many different engagement survey providers with different tools who can then link to other tools to drive dashboards into part of your performance management. The key is, what does one want to be, and to who do they want to ultimately market themselves, right? And so, because I think there's no lack of no shortage of needs that are out there. It's what is it that any one organization wants to do? Who are your competitors? Is that need being met? And if not, if it's simple enough, and that's the one thing that I've learned over time is these tools, technologies, they're very sophisticated and can be very sophisticated on the back end, but they have to be simple to use on the front end, right? Without that, you lose people very quickly, right? And so I think, to me, that's when you think about all the changes, all the specialization, it still has to be simple to use and drive outcome that's filling a need. And so, hopefully that answers your question, because I've seen a ton of change, and there's, I don't think a day goes by that I don't get a couple of emails or calls on, hey, would you like to use this technology? We have this to offer, and sometimes it's hard to even figure out what is it that you're offering, right? So this clarity of message is so important.
And do you think that, and maybe, just rephrasing my question again, do you think that it has got simpler? Do you think the tech market or the recruit tech or the HR tech market is listening, and actually the newer tools that you're seeing in the market, forget the functionality, but just are simpler to use, like more from a UX or a UI kind of perspective? You think that is happening, or you think the industry is still a bit behind on that?
I think the industry is still a bit behind. That's my perception. Now, there are a lot of, when you take HCM tools, like the thing, like Workday is, sort of the key example that a lot of people leverage here, right? It's how easy is that to use versus the old days when you think about PeopleSoft and SAP and how these ERPs all integrated. But Workday is pretty simple, right, relative to those tools, right? And so, not to give a shout out to them, but using them as an example, how can recruiting tools then plug in to Workday if they are, the main HCM across the Fortune 1000, right? So it's a different mindset. You could have the greatest tool, but if it doesn't have interoperability with HCMs, the second you hire them, it has to go into the HCM, right? The individuals. And so thinking through it from that lens that's why I say my perception is we're still not there, is because I think the focus is on I have the greatest tool versus I have the easiest tool to use, right? And that to me that's why I think there's tons of strides being made, but the operability and the user interfaces, there's still some work to do to get up the curve, is what I would say. The thing that I always tell people is, my kids were using Apple products at 2 and 3 years old. It's intuitive. It's a swipe, right? So that's how easy it should be if people really want to gain traction in the marketplace.
I think that's a great call up, right? It's not a question of building a great tool, but it's a question of how easy it is. I think the key word is how easy, not I mean, everybody says, you rightly said, everybody thinks they have a great tool, and I'm sure they do, right? But that's not really the main point here. That I think was a great piece of advice to the HR tech, recruit tech industry, Matt. I think hopefully people will start following that. Yeah, Jess, over to you for the next part.
Yeah. Well, maybe Matt, before we go on, why don't you tell people what the website is, how to find careers if they want to come work for you, how to connect with you on the internet? Is LinkedIn a good place? Or let's start there.
All the above. So our website is agilonhealth.com. There's a careers landing page there. Go ahead and see all of our different opportunities. We're also accessible via LinkedIn. Certainly our opportunities, we do push them through our talent acquisition team out through LinkedIn as well. And so, like I said, we're a growing company, have tons of opportunities. We've been fairly successful in the marketplace. I think that's highly related to what we do and how we want to build our culture here. And so, I appreciate you guys allowing me to give the plug there, and highly advise anybody who's interested in healthcare and healthcare technology, and give us a look, and hopefully we'll be able to meet your needs, and you can meet our needs as well.
I love it. Well, maybe to finish off here, what's one of your favorite pieces of advice you've ever received?
From a career standpoint, it's very hard when you're young to listen, whether it's from your parents or from a first-time boss, when everyone tells you to have patience, right? But I remember when I was first, coming into a corporate setting, and a senior leader, was telling me, "Hey, we're asking you to come in and work hard because we see something in you, right? You're gonna make mistakes." And I think in today's world, people they almost think like you can't make mistakes, right? I felt so at ease hearing that from a senior leader saying, "Hey, go give it your best shot. Go in there, work really, really hard, and then, learn from it," right? That's why when you come into your career or advance at every stage, you're constantly learning, right? And that's part of what you have to continue to grow and learn and develop. And then he paused and he told me, there will be a day when if you want to get to where you're telling me you want to get to one day, you want to be able to learn as much as you can now through those mistakes, because one day you're going to be telling someone else to do the same thing, because you're going to have learned from those mistakes and sort of how to look around corners and how to bring everyone together to solve big problems, right? And so I just think in the world that we're living in today, the expectations, whether self-inflicted or from others, is just so high that it's okay to say, "I don't know, but let me go figure it out. Let me go ask for help," right? I tell people, what I look for most importantly when I'm talking to people is, do they ask the right questions, right? Because if they're telling me all the answers, then they got it all figured out. That's a lot different than asking the right questions to get to the right answers, right? And so it's okay. You don't have to have all the answers, but let's figure it out. Ask the right questions, and we'll get to the right place.
I love it. That's great. That's a great place to end. Thanks for making time to do this.
I appreciate you guys having me on today, Jess and Gato.
Thank you, man.
Yeah. Bye, everyone.